the stories that you hear that, oh, maybe it's because you're not, starvation does not cause ulcer. It does not cause ulcer. It just increases your ulcer. Have you ever felt a form of pain in your stomach that hurts so much and you eat, even after eating, there is no form of relief? Or you hear people tell you, take milk now, or you take Gestid or Mistmag, and even after taking all of these things, you get a form of relief. But is that really the solution? Come closer, come closer. Let's talk about peptic ulcer. Now, peptic ulcer, stomach ulcer means the same thing. Let me not confuse you. Let me use the normal language that you all know, stomach ulcer. Now, stomach ulcer is a form of wound that is in the stomach. Layman language, I hope you understand that enough. So now, in the stomach, there is a particular acid called hydrochloric acid that help in the breaking down of food that you've taken. So whenever you eat, this particular acid helps to break down this food into smaller bits for absorption in the body. But God is a very great God, and he didn't just leave the acid there, because you know how acid can be very, very, very harsh. Now, this is what God did. He created a particular lining in the stomach, a mucus lining that helps to protect the stomach against this particular acid, so that there will not be any form of injury. It's just like when you pour acid on your skin. What do you expect? Injury, and there will be pain. Now, this particular covering that is covering the stomach, this lining that is covering the stomach, protecting the stomach against this. Now, due to certain reasons, due to certain factors, which I will still be explaining later, this particular lining becomes wounded. Now, let's talk about the causes of ulcer. There are two major causes of ulcer. The number one on my list is this particular bacteria called H. pylori. H. pylori is a very, very, very wicked bacteria, because what it does is it destroys the lining of the stomach, which allows the acid to be feasting on the stomach directly. So there's no form of protection, and that causes a lot of injury. And when you have injury, what do you feel? Pain. And that's how ulcer comes about. And how can you get H. pylori? H. pylori can be ingested through contaminated food, through kissing. Hello? So it can be gotten through kissing, through contaminated food. Maybe you ingest it while eating dirty food and all of that. That's how H. pylori can get into your system and can cause ulcer. Another major cause of stomach ulcer is intake of painkillers. I'm not saying painkillers are bad, but there are certain painkillers that causes ulcer. They will increase the secretion of hydrochloric acid in the stomach. These painkillers are called NSAIDs. Examples are ibuprofen, diclofenac. Before you know it, small thing, small pain, you already took diclofenac. Small pain, you already took ibuprofen. Those things will increase, consistent taking of these medications will increase the secretion of hydrochloric acid in your stomach. Now, another cause I can bring in now is stress. Just stress alone might not cause it, but it will increase the secretion of hydrochloric acid in your stomach. Can ulcer be healed? Can ulcer not be healed? Will you keep having ulcer all your life? Hey, my ulcer will not go again. Listen very good. Ulcer can be healed. Now, ulcer can be healed when there is complete treatment. Ulcer will be treated based on the cause of the ulcer. And before you can know what exactly causes your ulcer, when you run certain tests, there are some tests, diagnostic tests that you run in the hospital that they will tell you that, oh, this was what caused your ulcer, so let's tackle this. Many people doesn't know this. They just take drug. Oh, you're taking omeprazole for your ulcer. Okay, let me take 2. Maybe that will work for me. No. That's not what you need. The cause of your own ulcer might be as a result of this bacteria, whereas you have to use an antibiotic, not a proton pump inhibitor. When you realize the cause of your ulcer, the treatment will be easy. And please, let me say this. Intake of milk doesn't stop ulcer. So there was this particular day I was at the hospital. I had a patient, and this patient has ulcer. We're managing for peptic ulcer. This is PUD. And she was feeling the pain again, and they wanted to call my attention. And I was just there monitoring what they were doing. Then I saw the relative telling her, oh yeah, go and get milk. And I was like, no, you push your hold on. Why are you getting milk for her? See, I'm not saying milk is not good. Let me explain the effect of milk on your ulcer. After your body breaks down milk, the end result of milk is lactic acid. We're fighting acid. You are introducing another form of acid. Does it make any sense? I want to just beg you, when you're having certain symptoms like burning sensation in the chest, the stomach, radiating to the back, when you're having bloating stomach, when you feel full easily, nausea and vomiting, those are the symptoms of ulcer. And when you start feeling this way, go to the hospital. Don't self-medicate. Don't say because my mom is using omeprazole, let me take omeprazole with her. Go to the hospital. Your cost might be different from ours. Please. One thing about ulcer is just treatment doesn't work. Treatment and lifestyle work hand in hand. When you're giving you medications, when you get home, the kind of food you eat matters. You stop taking alcohol, you stop smoking, all those things, you have to reduce them so that it can help your medications to work properly. I hope I make any sense. So that's just my advice for you today. If you are feeling any way, go to the hospital and please take your medications. Complete those. Completion of those will help in the complete treatment of ulcer. Ulcer kills. In case you've not heard someone tell you before, ulcer kills. When it gets to certain stages and you're already vomiting blood, you're stooling blood, I know we don't want to get to that point, but please take care of your ulcer. I know this is not like my regular videos, my regular talk. Yeah, I just realized that I've not really been making use of my profession. People even question my nursing profession. They are not very sure if I'm a nurse or not. So expect more of health talk, health gist this period. So I'm going to be giving you guys, I'm going to be bringing to your table tips on healthy living, how to tackle certain conditions, certain illness in your body. Yeah, so that's what I thought to share today. Please, do you enjoy this video? Did you enjoy it? Was it educative to you? Was it educative to you? Oh yeah, subscribe to this channel. Don't forget to like it, share it to someone. I know you know someone that has ulcer and is battling on how to manage it. Subscribe, share it to somebody. There is a notification button there. Click on it so that you'll be notified every time I drop educational videos like this. Thank you so much for watching. See you in my next video. Bye.